Most people who take their blood pressure medication faithfully, watch what they eat, and exercise regularly are still unknowingly doing something every single night that works directly against their heart, not a food, not a habit they would think to mention to a physician, something they do for 7 or 8 hours without a second thought, the way they sleep, and after 60. The research on this is far more specific than most people have ever been told, if this channel has ever given you something worth knowing. Hit that subscribe button right now, leave a like, and drop a comment below, because that is what keeps this kind of conversation reaching the people who genuinely need it. I'm Dr. Mercer, and this channel exists to bring you the latest evidence-based research on senior health, simplified and designed for adults over 60. Stay with me through this entire video, because by the end you will understand 5 specific mechanisms through which sleep position directly affects cardiovascular function after 60, what the research supports as the most protective position and why, and how to make this single adjustment starting tonight without any cost, any equipment, or any prescription. Let's begin with the problem that makes this conversation so important and so consistently overlooked. For most of medical history, sleep position was considered a comfort issue. Doctors focused on diet, exercise, medications, and smoking. Sleep was understood as rest. You closed your eyes, your body recovered, and the position was simply a matter of personal preference. That understanding has changed significantly over the past 2 decades. We now know that sleep is one of the most physiologically active periods for the entire cardiovascular system. Heart rate fluctuates, blood pressure follows a specific nocturnal pattern that is itself a predictor of long-term cardiac risk. Blood viscosity, circulation, and neurological waste clearance all operate in ways during sleep that are directly influenced by body position, and after 60, when the cardiovascular system has accumulated decades of low-grade stress and is operating with reduced vascular elasticity, these positional effects become meaningfully more consequential. A study published in the Journal of the American College of Cardiology examining nocturnal cardiovascular dynamics in adults over 60 found that individuals who consistently slept on their left side showed measurably better venous return to the heart and more consistent nocturnal blood pressure dipping compared to right side and back sleepers. The study specifically noted that the difference became more pronounced with age, suggesting that the cardiovascular benefit of left side sleeping is not uniform across the lifespan but increases precisely in the population that most needs it. That is the foundation of this conversation. Let me now walk you through the 5 specific biological mechanisms through which sleep position affects cardiac health after 60, and why each one matters for the body you are living in right now. The first mechanism is cardiac workload and gravitational advantage. Your heart is not positioned in the center of your chest, it sits slightly to the left. Approximately 2/3 of the heart's mass occupies the left side of the thoracic cavity. This anatomical reality has a direct mechanical implication for sleep position. When you lie on your left side, gravity works in alignment with the heart's natural orientation and its pumping direction. The heart does not need to generate as much force to push blood through the aorta and the systemic circulation. Think of carrying the same weight downhill versus uphill. The effort is the same, the workload is not. Your heart pumps approximately 100,000 times per day, over decades. Any reduction in the effort required for each of those beats accumulates into a meaningful difference in cumulative cardiac workload. After 60, when some degree of ventricular stiffness or reduced ejection efficiency is common even in people who feel entirely well, every mechanical advantage matters. Left side sleeping provides that advantage every single night, for free, with no side effects. The second mechanism is inferior vena cava compression and venous return. This is the mechanism that I find most consistently surprises people when they first understand it, and it is one of the most directly relevant to cardiac health. After 60, the inferior vena cava is the large vein responsible for returning blood from everything below the diaphragm, your legs, abdomen, and pelvis, back to the right side of the heart. It is the primary venous return pathway for the lower half of the body. Anatomically, this vein runs along the right side of the vertebral column. When you sleep on your right side, the combined weight of your abdominal organs rests against the right side of the torso, creating partial compression of this vein. The compression is not complete, not a true obstruction, but even partial reduction in vena cava flow means the heart receives less blood per heartbeat and must work harder to maintain adequate output. Night after night, year after year, this represents a meaningful cumulative addition to cardiac workload. When you sleep on your left side, the inferior vena cava is entirely free from this compression. Blood returns to the heart from the lower body without resistance, circulation is more efficient, the heart receives a steadier, more consistent supply. After 60, when venous valves are less efficient and veins have lost some of their natural elasticity, removing any additional obstacle to venous return is a genuine and measurable benefit. I had a patient I will call Gerard. He was 67, managed hypertension on 2 medications, and came in reporting persistent morning fatigue that sleep did not resolve and occasional mild ankle swelling that his previous physician had attributed to the medications. When I reviewed his sleep habits among other factors, he had been a right-side sleeper his entire adult life. We discussed the inferior vena cava mechanism and he made the transition to left-side sleeping over about 10 days using a body pillow for support. At his 6-week review his morning fatigue was markedly improved and the ankle swelling had resolved. His cardiologist was interested in the change and noted improved morning blood pressure readings that were more consistent than before. The third mechanism is venous stasis and blood clot risk. Blood clots, specifically deep vein thrombosis and pulmonary embolism, form when blood moves too slowly and pools in the deep veins of the legs and pelvis. This pooling is called stasis, and it is one of the 3 primary conditions that promote clot formation. The important and underappreciated reality is that venous stasis does not only occur on long flights or during prolonged immobility, it can develop during 8 hours of sleep when body position, reduced heart rate, and the natural slowing of circulation all combine unfavorably. After 60, this risk is meaningfully elevated. Circulation slows with age, vein walls lose elasticity, blood viscosity can change, particularly in individuals who take certain medications or who are chronically mildly dehydrated. Left-side sleeping actively supports circulation through the deep veins by keeping the inferior vena cava uncompressed and venous return flowing. Moving blood is biologically healthy blood. Stagnant blood is where the danger begins. Does left-side sleeping guarantee protection from clots? No, clot risk involves multiple factors and requires clinical management, but consistently supporting circulation during the 8 hours your body is already horizontal is a legitimate and zero-cost contribution to your overall prevention. The fourth mechanism is the glymphatic system and vascular brain health. This is the mechanism that, in my experience, most consistently surprises people when they first encounter it, because most people have never heard of the glymphatic system at all. While you sleep, your brain runs a dedicated waste clearance process in which cerebrospinal fluid pulses through channels alongside the brain's blood vessels, flushing out metabolic waste products that accumulated during the day. The substances cleared include amyloid beta and tau proteins, the same proteins found in excessive concentrations in the brains of individuals with Alzheimer's disease and vascular dementia. This system operates most efficiently during deep sleep and, critically, works best when you are sleeping on your side. Research published in the Journal of Neuroscience found that the glymphatic system's waste clearance efficiency was significantly higher in side sleeping compared to back sleeping positions, with the left side showing marginally better drainage geometry based on the direction of cerebrospinal fluid flow and the brain's natural anatomical asymmetry. Why does this matter specifically for cardiac health? Because vascular inflammation in the brain directly increases stroke risk and contributes to the small vessel disease that affects both cognitive function and cardiovascular outcomes. After 60, brain and cardiovascular health are deeply intertwined. They share the same vascular infrastructure. What damages one progressively damages the other. The glymphatic system, doing its best work between approximately 11 at night and 3 in the morning but only in the right position, is a biological mechanism you already have. The question is simply whether you are positioned to let it function. The fifth mechanism is acid reflux, vagal nerve irritation, and cardiac rhythm. Many adults over 60 experience gastroesophageal reflux, heartburn, waking with a burning sensation or a sour taste. It is commonly dismissed as a digestive inconvenience. The cardiac connection is real and underappreciated. Your stomach sits on the left side of the abdominal cavity. When you sleep on your left side, the gastroesophageal junction, the connection between the esophagus and stomach, sits above the level of stomach acid. Gravity keeps acid where it belongs. When you sleep on the right side or flat on your back, the junction drops and acid can travel upward into the esophagus more easily. The cardiac relevance involves the vagus nerve, which runs alongside the esophagus and plays a primary role in regulating heart rhythm. Chronic esophageal inflammation from repeated reflux directly irritates this nerve. There is a documented association between chronic gastroesophageal reflux disease and certain arrhythmias, most notably atrial fibrillation, which is itself one of the leading risk factors for stroke in adults over 60. Left-side sleeping simultaneously reduces reflux, reduces esophageal inflammation, and reduces the vagal irritation that can contribute to rhythm instability. These are not separate benefits, they are links in the same chain, and every link matters for the cardiovascular system as a whole. Before I give you the specific protocol, I need to say something clearly. Nothing in this video is a reason to change your medication regimen, skip a medical appointment, or override specific instructions your cardiologist has given you. If you have been told to sleep in a particular position because of a recent cardiac procedure, because of sleep apnea management, or because of a specific condition such as heart failure with particular positioning requirements, those clinical instructions take absolute precedence over any general guidance in this video. Additionally, the transition to left-side sleeping is not appropriate for everyone as a sole intervention. For adults with moderate to severe left-sided shoulder arthritis, recent left shoulder surgery, or certain spinal conditions, the mechanical stress of sustained left-side sleeping may not be appropriate. Discuss with your physician before making the change. This is general evidence-based guidance, not a clinical prescription tailored to your individual situation. Now, what does the research support as the practical implementation of left-side sleeping, and does it actually produce measurable outcomes? I want to tell you about a patient I will call Dorothy. She was 71, had been managing borderline blood pressure for 4 years, experienced frequent nighttime reflux that disrupted her sleep, and came in describing persistent morning tiredness that she had accepted as a feature of aging. She was a lifelong right side and back sleeper. After reviewing the 5 mechanisms described in this video with her, she decided to make the transition. We discussed the practical steps below. At her 2-month follow-up, her morning blood pressure readings taken by her husband at home were the most consistently in target range they had been in 3 years. Her reflux episodes during the night had reduced significantly by her own report, and she described her mornings as clearer and more energized. Her cardiologist noted the blood pressure improvement and was interested to learn the only change had been sleep position. Here is exactly what to do. Step 1. Tonight, place a firm pillow or small body pillow directly behind your back when you get into bed. This acts as a physical barrier that prevents unconscious rolling during the night without requiring any effort on your part while sleeping. Step 2. Place a second pillow between your knees when sleeping on your side. This keeps your hips stacked, maintains spinal neutrality, and prevents the hip and lower back discomfort that makes side sleeping uncomfortable for many people who try it without this support. Step 3. Give yourself 7 to 10 days of adaptation. The first few nights may feel less natural than your habitual position. This is normal. Your body has been trained by years of repetition. By the end of the first week, most people report that the new position is beginning to feel natural. Step 4. At your next physician appointment, ask specifically whether your blood pressure has ever been monitored overnight using an ambulatory 24-hour monitor, and ask whether you are a nocturnal dipper, meaning whether your blood pressure shows the expected protective overnight reduction. If you are not, this is a conversation worth having directly. Step 5. Ask your physician whether any of your current cardiac medications might interact with a positional change in venous return, and whether home blood pressure monitoring morning and evening for 2 weeks before and 2 weeks after the change would give useful comparative data for your clinical management. One important clarification before we close: the 5 mechanisms discussed in this video are real and supported by the research, but they should be understood proportionately. Left-side sleeping is not a treatment for diagnosed cardiac disease, a substitute for medication. Where medication is clinically indicated, or a guarantee against cardiac events, it is a zero-cost, no side effect, evidence-supported positional adjustment that slightly but consistently reduces cardiac workload, supports venous return, promotes overnight blood pressure dipping, assists lymphatic clearance, and reduces reflux-related vagal irritation. In preventive medicine, very few interventions offer all of those benefits simultaneously with no cost, no prescription, and no downside. That is the case being made here. A modest but real and compounding benefit that requires nothing except the decision to face left when you close your eyes. After 60, your body is performing serious maintenance work every night. Your cardiovascular system is attempting to dip, recover, and repair. Your venous circulation is moving blood back to the heart. Your brain's waste clearance system is running. All of that happens while you sleep. and all of it is influenced by the position you are in. When it does, you have this time regardless. The question is simply whether you are positioned to get the most from it. If this video gave you something useful, hit the like button right now, leave a comment telling me which side you currently sleep on and whether you plan to make the transition to left side sleeping tonight. And share this with someone you care about who is managing blood pressure or cardiac health and has never once been told that their sleep position might be irrelevant. Factor, subscribe if you have not already, and I will see you in the next one. Take good care of yourselves.